Have you ever stopped to consider that your everyday bedtime routine might unknowingly be putting your life at risk? It's a serious thought, but the CDC reports over 70,000 older adults in the U.S. die in their sleep annually. And what's truly alarming is that many of these deaths aren't purely age-related. Instead, they're often connected to small, seemingly insignificant nighttime habits that we frequently ignore. After the age of 55, your body undergoes notable changes. Your heart, lungs, and brain become more sensitive, sleep tends to lighten, and muscles naturally weaken. Actions that were once harmless before bed can now become quite dangerous. Many seniors simply continue with their long-standing routines, completely unaware they may be quietly compromising their health and safety. So, what exactly are these hidden nightly threats? Which common mistake leads to the most nighttime emergencies? And most importantly, how can you make your sleep safer, starting tonight? In this video, we're going to delve into 7 habits that have been linked to senior deaths this past year. Pay very close attention to habit number 2. It's surprisingly deadly. But don't worry, I'll provide you with simple, actionable steps to protect yourself. If you're new to our channel, a warm welcome. Let's grow stronger and healthier together. Be sure to like this video and subscribe so you don't miss our latest updates. And please, share your country in the comments. We love seeing our global community grow. Let's get started. Harmful sleep habit 7. Drinking too much before bed. It seems like such an innocent habit, consuming excessive fluids right before sleep. Staying hydrated is undeniably vital, especially as we age, supporting organ function, digestion, and joint health. However, overhydrating just an hour or two before bedtime can become a significant issue for older adults. As we get older, our kidneys process fluids slower, bladder capacity tends to decrease, and the urge to urinate becomes much more sudden. Downing a lot of water, juice, or tea within an hour or two of sleep means your body is highly likely to interrupt your precious rest with urgent bathroom trips. Waking up at night might seem minor, but for seniors, it dramatically heightens the risk of nighttime falls. Imagine being groggy in the dark with reduced balance. Standing up quickly can cause a sudden drop in blood pressure. What should be a quick trip to the toilet can quickly turn into a dangerous fall. The CDC states that falls are the leading cause of hospitalization for seniors, with a significant number occurring during these nighttime bathroom visits. Frequent nighttime urination also fragments your sleep cycles, particularly the crucial deep sleep that's essential for both brain and body restoration. Chronic sleep disruption is linked to memory loss, increased inflammation, and a higher risk of conditions like dementia and Alzheimer's. Poor sleep also weakens your immunity and can worsen existing conditions like diabetes and high blood pressure. There's also increased strain on your heart. Excess fluid at night means your heart has to work harder. For those with underlying heart issues, this can even trigger irregular rhythms or place undue stress on the heart. The safest approach to hydration involves timing and balance. Drink sufficiently earlier in the day, gradually reducing your intake as evening approaches. Try to avoid heavy fluids for at least 2 hours before bed. If you find yourself thirsty right before sleep, take small sips, not a full glass. Also, steer clear of caffeine and diuretics like black tea, coffee, and citrus juices late in the day. If you absolutely must get up, ensure your path is safe. Use night lights, clear any clutter, stand up slowly, and move with caution. These small adjustments help you balance proper hydration with safe, restful sleep. Harmful sleep habit 6. Eating late at night. A late-night snack might feel harmless, but for older adults, it can significantly disrupt overall health. That innocent treat can lead to issues far beyond simple indigestion. Our aging bodies process food differently. Metabolism slows down, digestion isn't as smooth, and managing blood sugar and cholesterol becomes more challenging. Eating heavy or rich foods late denies your digestive system the rest it needs. Instead of repairing and rejuvenating, your body actively processes the meal, disturbing your sleep and placing stress on your heart, liver, and digestive organs. A common problem stemming from late-night eating is acid reflux. Lying down shortly after a meal allows stomach acid to flow back into the esophagus, causing that familiar burning sensation in your chest. For seniors, this is more than just discomfort. It can lead to inflammation, damage to the esophagus, and even aspiration pneumonia if food particles are inhaled during sleep. A study showed that eating within 3 hours of bedtime significantly increases the risk of nighttime reflux. Another concern, sugary foods and refined carbohydrates in evening snacks can cause a spike in blood sugar. Aging cells are often less responsive to insulin, hindering efficient glucose management, which can potentially lead to or worsen type 2 diabetes. A 2020 study confirmed the link between late-night eating and higher morning blood sugar and insulin levels in older individuals. Then there's blood pressure. It normally drops during sleep, allowing your heart to rest. Eating late, especially fatty or salty foods, can keep it elevated, increasing your risk of stroke and heart attack. Heavy evening meals can sometimes even trigger irregular heart rhythms, which are particularly dangerous for those with existing cardiac problems. Stay safe by carefully considering timing and food choices. Aim to finish your last meal at least 3 hours before bedtime to allow for proper digestion. Opt for lighter, balanced dinners. Think vegetables, lean protein, and whole grains. Skip heavy, greasy, or sugary items. If you truly feel hungry later, choose something small and gentle on your stomach, a banana, a small yogurt, or a few unsalted nuts. They're easier to digest and won't cause a significant blood sugar spike. Adjusting your routine slightly means sounder sleep and a lower risk for issues like heartburn, high blood sugar, and cardiovascular stress. Giving your body the nighttime rest it deserves helps you feel stronger and healthier every single day. Harmful sleep habit 5. Sleeping in the wrong position. Everyone has a favorite sleep pose, but for many older adults, that preferred position could quietly be risking their health. As you age, your sleep position directly impacts your breathing, heart function, and even brain health. One of the worst positions for seniors is sleeping flat on your back, supine. While it might feel restful, it can trigger a host of issues. Lying on your back allows gravity to pull your tongue and throat tissues backward, narrowing your airway. This is especially concerning for snorers or those with sleep apnea. Even without a diagnosis, airflow can be restricted. Mayo Clinic studies show that back sleeping worsens breathing issues by up to 40% compared to side sleeping. The effects of restricted airflow are serious. Lower oxygen levels increase the risk of obstructive sleep apnea, characterized by repeated breathing interruptions. Over time, this raises blood pressure, can cause brain damage, and significantly increases the risk of heart attack and stroke. Research shows that seniors who consistently sleep on their backs face a 22% higher chance of nighttime cardiac events than those who sleep on their sides. Breathing isn't the only issue. For seniors with acid reflux or a hiatal hernia, back sleeping worsens symptoms, making it easier for acid to move into the esophagus, often called silent reflux. This damages the throat lining and increases the risk of aspiration pneumonia. Repeated acid exposure over time can even contribute to esophageal cancer. Evidence also shows that sleep position affects brain cleaning. A Stony Brook University study found that back sleeping reduces the brain's waste clearance system by over 60%. This crucial system flushes out toxic proteins linked to Alzheimer's and dementia. Poor sleep posture could accelerate cognitive decline in older adults. Even sleeping on your right side has drawbacks. It can compress the heart's major blood vessels, interfering with circulation and raising the risk of heart failure, particularly if you have existing heart concerns. So, what's the safest way to sleep? Experts largely agree. Sleeping on your left side is best. It supports better circulation, aids healthy digestion, and reduces acid reflux and stroke risk. It also helps your brain's waste clearance, protecting your mental function. Switching positions might feel awkward at first, but a few tricks can help. Use a firm pillow between your knees for hip alignment. Tuck a pillow behind your back to prevent rolling onto your back. A supportive neck pillow helps maintain proper spine and head position. If reflux is an issue, slightly raising the head of your bed can be beneficial. Training yourself takes effort, but the health rewards are immense. Adjusting your sleep position lowers the risk of breathing troubles, heart strain, and mental decline, leading to better rest and a healthier future. Harmful sleep habit 4. Sleeping in a hot room. We instinctively seek warmth at night, and this is especially true for older adults. It's natural to want coziness, turning up the thermostat, layering blankets, keeping windows closed. But a warm bedroom can silently put older adults at risk. For seniors, the right sleep environment is not just about comfort, it's about health and safety. Your body naturally lowers its core temperature to signal the onset of sleep. This cooling process helps you enter the deep, rejuvenating stages of sleep. If the room is too warm, typically above 20 degrees Celsius or 68 degrees Fahrenheit, your body struggles to release heat. Instead of resting, your system works to cool down, causing interrupted sleep, frequent waking, and next-day fatigue. Heat's impact goes beyond mere restlessness. Older adults are more vulnerable because their temperature regulation weakens with age. Findings show that seniors in warmer rooms get up to 30% less deep sleep, which is essential for memory consolidation, immune support, and cell repair. Missing out on this leads to larger concerns. A lack of quality sleep contributes to inflammation, elevated blood pressure, and impaired immunity, increasing the risk of heart disease, type 2 diabetes, and mental decline. Research warns that persistent heat-induced sleep loss may accelerate memory deterioration and increase vulnerability to infections. Another hidden danger is dehydration. Seniors often feel less thirsty, and night sweating can lead to a loss of fluids and electrolytes, thickening the blood and raising the risk of clots, irregular heartbeat, or stroke. For those with heart or lung issues, the burden of regulating heat at night could even trigger heart failure or respiratory distress. So, what's the optimal sleep temperature? Experts recommend a range of 15 to 19 degrees Celsius, 59 to 66 degrees Fahrenheit. Use light, breathable bedding, like cotton, and avoid heavy quilts or electric blankets. If you feel chilly, use layers that are easy to remove. A fan or a slightly cracked window can improve airflow, reducing trapped warmth. Small environmental changes can make a big impact. Cooling your bedroom isn't just about comfort. It protects your heart, preserves your memory, and supports better sleep quality. For seniors, a cooler space is a simple, yet powerful step toward healthier aging. Harmful sleep habit 3. Getting out of bed too quickly. Have you ever woken up at night, swung your legs over the side of the bed, and suddenly felt lightheaded, or like the room was spinning? You're not alone, and it's a very real phenomenon. For older adults, sudden movements when rising are more dangerous than many realize. This common habit causes countless falls, injuries, and emergency room visits every single year. The issue at hand is postural hypotension, also known as orthostatic hypotension, a sudden drop in blood pressure when you move from lying or sitting to standing. As we age, our circulatory system's ability to quickly adjust to changes in position slows down, causing blood to pool in the lower body. This momentary lack of blood flow to the brain causes symptoms like dizziness, blurred vision, or even a brief loss of consciousness. This isn't a minor inconvenience, it's a real threat. Research shows that seniors with postural hypotension face a much higher risk of falls, fractures, and tragically, even death. Falls are the leading cause of injury-related hospital admissions in older adults, and many occur late at night or early in the morning when bodies are adjusting and blood pressure tends to be lower. The fallout from a bad fall can be devastating. Hip fractures, head trauma, and broken wrists are common. Recovery is often long and painful. A single fall can lead to reduced mobility, loss of independence, or serious long-term complications. This habit needs to be taken seriously. Preventing it doesn't require a major overhaul. The most effective approach is to simply slow down. When waking, sit upright on the edge of your bed for a few moments, allowing your blood flow to regulate. Gently move your feet, flex your ankles, and breathe deeply. This gentle movement helps your circulation adjust, minimizing those sudden blood pressure swings. Keep water by your bedside and sip slowly before standing, especially if you feel dehydrated. Environmental safety also matters. Light up your path to the bathroom using night lights or motion sensors. Avoid slippery socks or non-slip slippers. Keep walkways clear of clutter and loose rugs. If possible, hold on to furniture or a grab bar for stability. If you're on blood pressure medications like diuretics or beta blockers, talk to your doctor. They may be able to adjust your dose or timing to reduce this risk. These small routine changes can significantly lower your chances of dangerous falls, helping you maintain your independence and safety. Don't rush your waking process. Taking your time isn't just about feeling better. It's critical self-protection as you age each night. Harmful sleep habit 2. Ignoring snoring, breathing pauses, or chronic insomnia. Many people dismiss snoring as a minor annoyance, especially as they get older. But what if that nightly noise or those noticeable breathing pauses signal something far more dangerous? For older adults, ignoring these signs can lead to serious, even life-threatening, complications that often go undetected. One significant, yet overlooked, hazardous condition is obstructive sleep apnea. This occurs when the throat muscles relax too much during sleep, narrowing or completely closing the airway. Breathing stops briefly, often dozens or even hundreds of times throughout the night. Each one of these events causes a dip in oxygen, forcing your heart to work harder and putting a strain on your entire body. This repeated stress leads to high blood pressure, irregular heartbeats, and significantly raises the risk of stroke and heart attack. The statistics are eye-opening. The Sleep Heart Health study shows that untreated apnea raises the risk of a fatal heart attack by 30% and stroke risk by up to 60% in seniors. Nearly 4 out of 10 older adults may have sleep apnea, yet a staggering 80% of them remain undiagnosed. Many simply assume their snoring or nighttime awakenings are normal signs of aging, unaware they're actually symptoms of a serious, disguised medical condition. And it's not just your heart. Apnea and long-term sleep deprivation rob your brain of the deep rest it desperately needs. Without proper sleep, seniors may notice memory lapses, mental fog, and even early cognitive decline. Some studies suggest that untreated apnea can lead to brain tissue loss in memory and reasoning areas almost 3 times faster than typical aging. How can you tell if sleep apnea or a related issue might be affecting you? Often, someone else, like a spouse or caregiver, will notice first. Warning signs include loud snoring, gasping for air, long pauses in breathing, and frequent waking. Other symptoms can include morning headaches, dry mouth, and unusual daytime tiredness despite getting a full night's sleep. Insomnia, or difficulty falling or staying asleep, is another important clue. While occasional sleeplessness is common, chronic insomnia may point to underlying health issues such as heart problems, neurological conditions, or hormonal imbalances. It also disrupts your immune system and increases stress, making hypertension and diabetes harder to manage. If these symptoms sound familiar, it's crucial to act. Talk to your doctor or a sleep specialist. Treatments like CPAP therapy, lifestyle changes, and weight control can dramatically reduce the risks. Research shows that managing apnea can cut the risk of heart-related events by up to 42% in older adults. Snoring and sleepless nights aren't just irritating habits, they're serious health alerts. Addressing them safeguards your heart, supports your brain, and profoundly improves your overall well-being as you age. Harmful sleep habit 1. Taking certain medications before bed. Taking medication at night is a routine for many older adults, whether for sleep, blood pressure, or joint pain. It often feels harmless to take these pills right before bed. However, some common medications pose hidden dangers when taken at bedtime, especially as aging bodies process them differently. Sleeping pills and anti-anxiety medications like benzodiazepines, diazepam, clonazepam, alprazolam work by relaxing the nervous system, which helps with sleep. But they also slow down breathing and reduce alertness. For seniors, particularly those with heart or lung issues, this is risky. Research shows that regular users are more likely to suffer falls, fractures, and even premature death. The grogginess can linger into the next day, causing unsteadiness, confusion, and a higher risk of slips and stumbles. sleeping pills aren't the only concern. Muscle relaxants and certain antidepressants prescribed for nighttime use can interfere with the deep sleep your brain needs to stay sharp. This lack of quality rest contributes to memory problems, mental fog, and faster cognitive decline. Pain relief medications also require caution. NSAIDs like ibuprofen and diclofenac, while effective for joint pain, can stress the liver and kidneys with frequent use, especially at night. They also increase the risk of internal bleeding, particularly if you're taking other medications that affect the blood. Another common nighttime drug is for high blood pressure. While some individuals benefit from taking it at night, others can experience a sharp drop in blood pressure during sleep. This reduces blood flow to the brain, triggering dizziness, fainting, or even a stroke. Studies indicate that the timing of blood pressure medication affects nighttime heart health, and individual reactions can vary significantly. And don't forget drug interactions. As we age, our metabolism slows, meaning medications can build up more easily in the body. Mixing sedatives, painkillers, and heart medications without proper medical guidance is dangerous and potentially life-threatening. How can you stay safe? Always talk to your doctor or pharmacist before starting, stopping, or changing any medications. If you feel drowsy, foggy, or groggy, ask about non-sedating alternatives. Avoid sleep medications unless absolutely essential. Try natural options instead, such as chamomile tea, gentle stretching, or deep breathing exercises. If you're on blood pressure medications, track your readings and report any unusual symptoms to your doctor immediately. Staying informed and cautious with your evening medications is a powerful step towards protecting your health, preventing accidents, and improving your sleep quality. Thoughtful changes can make your nights safer and your mornings brighter. In closing, even minor adjustments to your nightly habits can profoundly impact your health and longevity. Now that you're aware of these 7 habits, I urge you to act tonight. Manage your medication schedule wisely, adjust your sleep environment for optimal health, and pay close attention to what you eat before bed. Each small shift supports a longer, healthier life. Have you unknowingly followed any of these habits? Do you have a tip that has helped you sleep better? Share your thoughts in the comments below. We'd love to hear what has worked for you. If this video helped you, please give it a like, subscribe, and join our community for more valuable health tips. Your path to better rest and health starts now. Thank you for being a part of our journey.